Hi, my name is Lindsay Hrynio, and I'm here to educate you today about Wolff Parkinson White syndrome. What is that? You may be asking. Maybe you've never even heard of it. I know I haven't really heard of it, but I did my research and I'm here to help you learn about it too. So, the objectives for my presentation today is I want staff to better understand what exactly WPW syndrome is, Wolff Parkinson White syndrome. I want you to be able to recognize if a student is yours or maybe not even yours and is in the hallway. Maybe they're exhibiting signs of this syndrome. Now, maybe you'll have a little bit more of a better idea. Learn how to create an environment the student feels safe, and of course, you feel safe and more prepared. Education is power. What is Wolff Parkinson White syndrome? So, as I mentioned, I didn't really know either, but I feel a lot better now that I do, and I can help other staff members and children, in fact, when I recognize they might be exhibiting symptoms. Wolff Parkinson White syndrome, it's a heart condition that's present at birth. It's a congenital heart defect. It is pretty rare, so if you haven't heard of it, you're not alone. It's basically an extra signaling pathway between the heart's upper and lower chambers. It causes a fast heartbeat, tachycardia. It's also called pre-excitation syndrome. So how does this happen? Well, the hallmark findings for a WPW syndrome pattern is there's a PR interval and prolonged QRS. It's got an upstroke, a delta wave. These patterns are caused by the fusion of ventricular pre-excitation. In a typical heart rate, the signaling, it goes smoothly. You're going about your day, and if you're beating at about a 60 to 100, you feel fine because your heart is doing what it should be. That mechanical syndrome, it's on target. But in Wolff Parkinson White syndrome, the electrical pathway connects the upper and lower chambers, and it allows the signals to bypass the AV node. So as a result, the heart signals don't slow down. They get excited, and that heart rate increases as well. So some signs and symptoms of Wolff Parkinson White syndrome, well, like we said, there's that fast heart rate. And with that fast heart rate comes all of these signs and symptoms. You may see a child with heart palpitations. They might be having chest pain. They might have difficulty breathing. They could become dizzy or lightheaded. Maybe they even faint, or they're tired, they're short of breath, they're anxious. Now, yes, these are general symptoms, and you're like, well, that could happen to basically anything. Well, there's signs to look out for because something might be going on with their heart that hasn't been diagnosed yet. In young children, sometimes they even are pale, they have faded skin, cyanosis, they're restless, they're irritable. Maybe they have rapid breathing and they're not eating well. Some complications with Wolff Parkinson White syndrome. Well, the most extreme, of course, is sudden cardiac death. So we want to never experience this, but it has been linked to it if not diagnosed, if not seen earlier. How do we diagnose this? ECG, EKG, or somebody can wear a Holter monitor. It's usually worn for about a day or more, and it records the heart and the child doing all of their daily activities. You can also use an event recorder, and that detects infrequent arrhythmias as they happen. You press a button when you're feeling symptoms, and that one's more and more like 30 days. Also, you can do a study on them, an EP. So how do we treat this? Well, a medical professional will tell you some certain treatments that help are vagal maneuvers. When you cough, when you bear down, when you slow down that heart rate, your symptoms get better. There's also medications if needed. They can be given IV or by mouth to restore that heart rhythm. Of course, absolutely prescribed by a medical professional first. There's cardioversion, also been known to help. When the medicine isn't working, the vagal maneuvers aren't working, this shocks the heart and resets it. And then, of course, there's catheter ablation, and that's a thin tube, usually inserted through the groin, which has been known to help as well. Many, many uplifting, positive stories out there. If you experience a child with Wolff Parkinson White syndrome, please look up all these stories online. They're very positive and there is a lot of help out there. So as a staff member, what can you do when a child has Wolff Parkinson White syndrome if you see them exhibiting signs and symptoms and you know already that they have this? Well, number one, you're going to observe for any signs and symptoms in an event. If they look dizzy, if they're faint, if they're short of breath, you're going to have that child blow into a blocked straw for about 10 to 15 seconds. This is a vagal maneuver position. They can even do a headstand or a handstand, with help, of course, from you, the adult. If you notice that their heart rate isn't lowering within 30 minutes, you want to call 911 or go to the hospital. Of course, what else can you do? Well, if you're their teacher, or their parent, you're going to help them get an IEP and a 504 since this is a medical diagnosis. You're going to modify that schoolwork if needed, if they're hospitalized as well, if they need to take tests and they're feeling anxious and they get signs and symptoms. So a 504 and IEP is absolutely needed. As far as restrictions, well, that's determined by their provider. They may or may not have any restrictions. Some people have this defect and they go unknown their entire life. But if they do have a high-risk pathway, there could absolutely be restricted strenuous activities, and that's a doctor's note, of course, to the school nurse. Resources for you, resources to tell the family. Depending on where they live, there is the Boston Children's Hospital, of course. There is all kinds of websites. If you go on familydoctor.org, you can put your location in and you can find a doctor in your area. If you're in South Jersey, there's CHOP. CHOP is the best. Up here, we have St. Barnabas and even Atlantic Health. Atlantic Health is all over the place, and you can go to the Children's Health Pediatric Cardiology part of their website and type in where you are and be able to find some resources. And again, lots of positive stories I found online about children and athletes even who had this condition, and they're treated and they can live a normal life. So in summary, prognosis is usually really good. So don't get upset. This is a very good prognosis. Some kids go undetected their whole life. So into adulthood, they never know. They don't need medical attention if their condition slows down. It's all pretty individualized and symptom-based, of course. So with the appropriate treatment and education, people with Wolff Parkinson White syndrome can have a normal life expectancy and excellent quality of life. So while I was doing this research, I used a bunch of resources, some articles and websites, of course, to make this presentation possible. I hope that you learned a little bit, as I did as well, about Wolff Parkinson White syndrome, and you can recognize when a student in your building or a student in your classroom is exhibiting signs, and you can advocate for them to get their IEP, advocate for them to see their pediatrician, just so they can be diagnosed and treated well. I hope you have a wonderful day and be able to recognize WPW and learned a little something from my presentation. Thank you so much. Goodbye.